Okay. So, good morning, everybody.
Good evening.
Or good evening, or or whatever, good afternoon, because we are very happy to welcome all of you for this translational research workshop on esophageal atresia. So we are very proud and to have all of you here. So a few of us are around the table here, coming mostly from Europe and France, of course. Some of you are, most of you are online, coming from everywhere in the world. We are more than 100 people online registered today. And we are very happy to have the most active groups on research all over the world about esophageal atresia. And we will try to address some of the hot topic and the future in esophageal atresia research and care. The goal is to share at what point we are now, the different groups working on that, and sharing the advance they get and the future of the care, the understanding of the disease, the cause of the disease, if we are very optimistic, and also to improve treatment of esophageal atresia patients. So we had a nice, very nice, distinguished set of moderators and speakers. And so we want to start without delay. So some housekeeping things. We are recording all the meeting, and so if you don't want small speakers to have your presentation recorded, please inform us and tell us. And we of course leave it from what we recorded. Sorry. And the other thing is that please use the Q&A or conversation to ask a question. We would love to have the most interaction as possible, even if we are online. And for some of you, it's early in the morning. For all of you, it's already end of the afternoon. To have the most discussion about what will be presented. So. And I also want to thank a lot my local team here for organizing that and being here to support this transition. Another thing is that we will share a project, a big project we have about Transisome is called about translational research about omics and epidemiology in esophageal atresia in the long term. And also this workshop it is on the umbrella of the French Agency for Research, but also ERNICA, which is a European Rare Network, and where esophageal atresia is one of the big topics, but also INOE, which is the International Network on Esophageal Atresia, a non-formal network working for years. Very active people and a very transdisciplinary approach. And also ESGAN, which is the European Society of Pediatric Gastroenterology and Nutrition, which at least supports with Monet, for example, this meeting. So it's time to start without losing much time. And the first presentation, which will be very short, I guess, except if you want not a few questions, but if you want to ask questions, of course, it's open. But it's just to set up the scene, to know where we are and what we want to address in this meeting. And it will be presented by Madeleine Omar from our group, which is who is assistant professor in our team. And so, Madeleine, if you want to start.
Thank you. This is not really easy to resume in only 10 minutes what has been done to date in esophageal atresia, but I will. Yes, the point is, what do we know? We know that esophageal atresia is a lifelong condition. It's a rare disease, of course, but the mortality has really dropped and is now less than 5% in the first years of life. And as you can see on this video, the first centenarian are expected in 2050. Maybe one of the, we have Graham Slater with us here, so maybe it's
It's my new goal.
And we know that this esophageal atresia has a multifactorial pathogenesis. We know because of heterogeneous phenotypes that it can be with associated malformation or not. It can be more frequent in several monogenic syndrome. We have some identification of causal genetic effects in less than 10% of the cases, and there is also a very low familial recurrence rate at 1%. But all of this suggests the contribution of epigenetic and environmental factors, and we also know that trachea and esophagus originate from the same embryonic bird, and so there is a control of under the control of differentiation genes. In terms of prenatal diagnosis, there are low sensitivity. Half of the births with esophageal atresia are known before birth, but all of them are known after. And it's mostly for long gap esophageal atresia, pure forms, because for forms with tracheoesophageal fistulas, it's only 12%. The thing that we use today is ultrasound, fetal MRI, and amniocentesis, which helps to dose digestive enzymes. But these techniques are not available everywhere, and they need specific expertise. Long gaps are the most severe form, and we don't have so many evidence about long gaps because it's a tiny group. It's the most rare form. But we know in terms of complication that there is nothing better than a native esophagus, and that esophageal replacement is the only tool that we have today, and it's kind of for a lot of patients replacing some complications by others. These patients have esophageal dysmotility, and it's a lifelong problem. They have lifelong abnormal esophageal peristalsis, which affects food bolus transport, but which is not related to dysphagia. And we have some clues to characterize more this motility, and this may help for to predict the clinical outcomes and to try to manage these patients in their dysmotility. We also know that in this patient, there might be some severe complication that they are possible. They might have complicated GORD, they might have EOE, and they might also have esophageal cancers. So what remains to be discovered? These outstanding questions that are listed here will be addressed during the workshop. So we have some challenges in prenatal diagnosis. We need to identify the causes of the disease. We need other tools to repair long gaps forms. We would like to predict complications, so as to develop personalized follow-up strategies. And we have some therapeutic challenges with dysphagia and dysmotility. So the great speakers of today will talk about bioengineering in the morning. We will have the patient involvement after. Just after the lunch break, we will talk about molecular mechanisms. We will set the scene of transisome and explain you what it's about this project. And we will finish the day with data learning and omics approaches. Have a nice day, everyone.